and thanks for all of you for joining us today to listen to a little recap and then discussions on what we are predicting for the upcoming session for both the pharmacy industry and industries as a whole. For those of you that live in Connecticut, you know that our recent elections were somewhat surprising in terms of the governor's race. We have currently a very unpopular governor. He has the lowest approval rating in the country in terms of his popularity, and that's Governor Malloy. And as a result, a lot of people were thinking that the people of Connecticut were looking for a change and that it would be time for the administration to come in and shake things up a bit. What ended up happening was not quite that at all. It was a very close election, and I think everybody knew that going into it. But the Democrats had a much better rallying than the Republicans had in terms of their local candidate efforts, their door-to-door activity, their social media, all of their outreach. It was incredibly organized, and it had been going on for quite some period of time. So, a lot of feedback there, whoever's on. So as a result, Lamont ended up winning. It went well into the night, and those of you who were watching the returns, and early in the morning, Stefanowski leading to Lamont. The largest part of the upset, if you will, came from same-day voter registrants in the cities of Bridgeport and New Haven in particular, and a huge number of absentee ballots from all across the state, which again was part of that very organized Democratic grassroots effort across the state, and that put Lamont over the top. So now Governor-elect Ned Lamont and his Lieutenant Governor Susan Bysowitz are trying to be very reaching out to all the different constituencies. They have reached out to business and Republicans. They've reached out to labor and other organized groups, and they have formed some transition committees. So while Governor-elect Lamont put together a small team of a transition team, and that team is advising him on some key positions, he has created these other working groups on various topics, and they are meeting as we speak, talking about various policies, and the big idea that Lamont has given them is he wants job creation and economic development. He thinks that's what's going to help Connecticut get back on its feet. So these subcommittees are now working. They are supposed to be reporting back on December 12th with recommendations that will be compiled into a working report, probably around the 17th or 18th of December, and then Lamont himself will be briefed on those recommendations in early January. Now, the key focus of Lamont in this whole process is he needs to put together a budget and a balanced budget. Governor Malloy did give him a transitional budget about 2 weeks ago. There were some interesting items in that budget, including scaling back tax cuts that had been previously approved by the legislature, reducing the CPA eligibility, legalizing recreational marijuana, legalizing sports betting, and lots of budget cutting. So Lamont is working on that right now with his folks. He is having a press conference early this afternoon to announce some of his key staff appointments. That will be his chief of staff and his budget director. I'm not sure what other announcements he will be making there, but some of that will be coming out this afternoon. It will be very important moving forward. One of the big things Lamont wants to do is bring the state employee unions back to the table to renegotiate some of the pension and health care savings, as those are unsustainable moving throughout the next few years of the budget. They were underfunded for many, many years, decades in fact, by both Republican and Democratic gubernatorial administrations as well as the legislature, and now it is very hard to catch up on these payments. It's causing a massive problem for the budget. So as we look forward to 2019 session, where they will be doing the biennial budget for 2020, the state is looking at a collective $4 billion for those. So it is kind of a bleak picture at the moment. Although interestingly enough, hard in the grassroots effort, knocked out a lot of Republican legislators. There were 3 longtime Republicans in Fairfield County that lost their seats. One of those seats had been Republican for over a decade. So what that means is big changes in the legislature. The Senate had been previously tied at 18-18. It is now a strong Democratic majority, 23 to 13. The House is a similar story. That was 80 Democrats to 71 Republicans. The Democrats picked up 12 seats there. It's 92 to 59. There is one final seat that is in question. It's going to the Connecticut Supreme Court because there was an election day error. A voting district had actually, one polling place had 2 voting districts voting there, and they had 2 different state representatives, and the ballot somehow got mixed up. So folks were voting for reps in districts that didn't even represent them. So it was a close race. That race was only won by 13 votes. So that is being challenged in, we'll go to the Connecticut Supreme Court, and the Republicans are pushing to have a new election done. So we will see what happens. But, either way, one seat is not going to make a difference when you're 92 to 59. So the interesting news is that the Progressive Caucus of the legislature that has been promoting a lot of very progressive issues over the last few years has picked up a number of new members. By their own count, they think they're up in the 40s now. They have a very aggressive agenda of items they would like to see addressed. They have a list called the Big Five that is paid family leave, minimum wage being raised to $15 an hour, the legalization of medical marijuana, the legalization of sports betting, and then the installation of tolls. So those are 5 big items that are on those folks' agenda. Many of those items have a very good chance of passing in both the House and the Senate now, that they are strongly Democratic, and there is also a Democratic governor. There is one glimmer of hope, and that is that the House and Senate are veto-proof. They don't have enough Democrats in either chamber to override a gubernatorial veto, but that really doesn't make a difference since the governor is a Democrat himself. So it'll be interesting to see who Governor-elect Lamont puts in place as chief of staff and a budget director. That's going to send a key message to all the parties that he's reached out to, saying that he wants to work with everybody. But we'll see what happens as that progresses. The legislature, in the meantime, the legislative leaders are meeting with all the caucus members. They will be announcing and appointing chairman of the committees by the end of December, and then the membership of those committees will be determined in a day or two before opening day, which this year is January 9th. So, as I said, the issues that we will be facing are going to be interesting. The legalization of recreational marijuana, that is certainly going to have an impact in many, many ways on the state. Lamont is hoping to gain the revenue from it, which is anywhere from $30 to $60 million, depending on who you listen to. But he is also saying he wants stringent controls. And there are other legislators that are not so concerned about the stringent controls. They are more concerned about getting in the revenue and other pieces. So there will be a lot of pushback. There will be a lot of groups that will be opposing it. So somewhere in the middle, I think we'll see something on that issue. But I am certain that Governor-elect Lamont will be putting that revenue into his budget in at least the second year at that biennial budget. Other issues we're expecting to see more on PBM regulation. As you know, last year there was a landmark bill passed with the backing of the administration doing and can try to perhaps limit some of those medications and the types of those medications. There's also the grave concern about minute clinics. And in speaking with the Medical Society, they tried to gain status against that merger and were denied. They are very concerned about the push that will now happen to direct insurance to the minute clinics instead of physicians' offices and other locations where they had previously sought medical attention. So that is a grave concern for the health clinics, for the doctor's offices, and should be a concern to the pharmacy community too, because you're going in there to their minute clinics and you're probably going to be getting your medications there as well. So that remains to be seen at the legislature. Opioids will continue to be a big issue. Many of the new legislators who are coming in have campaigned that they are looking for more opioid legislation, more stringent requirements there. CPA has been out in the forefront over that for the last 4 years, so we will continue to work closely with the legislators on that. In the past year, the Democrats in particular have tried to pass a mandate for health insurance. As you know, the federal penalty is lifted now. There's no more requirement, essentially, that people carry insurance, but Connecticut made
Gene, are you still there? Gene? Did we lose you?
Hello?
Oh, there you are. Okay, we got you back.
Yes. Now I can hear you. So,
Okay.
Telehealth changes will also be back on the table. There was a federal change in Medicaid that Connecticut has not taken advantage of yet. So there is some hope from the healthcare advocates that the telehealth changes will be happening moving forward. As I said, the budget issues are going to continue to dominate, and that's going to be a concern of ours moving forward. We have to continue to watch our reimbursement. Our Medicaid reimbursement was changed nationally a few years back, and now the state is supposed to be doing a survey every time we change those rates. My challenge is going to be meeting 41 new legislators. We have 30 new House members and 11 new senators, and those folks will be coming up in the next couple of weeks to the legislature, so we are trying to meet and greet and find out as much as we can about these folks moving forward. And that's going to be our big issue. Quick segue into our federal folks, who I believe are right after me. As you know, on the federal side, U.S. Senator Chris Murphy won very handily his reelection. He was primarily responsible for the great effort that went on in Connecticut with the Democrats and their grassroots activities. He had donated an awful lot of money from his PAC to the state Democratic PAC and got those grassroots groups forming all over the state, probably about over a year ago. So he has been very instrumental in helping rebuild the Democratic Party in Connecticut, and I think a lot of the credit for the election wins across the state certainly go to him. On the congressional side, all the 4 of our incumbent Democratic legislators are all back. That would be Larson, Hines, Courtney, and Rosa DeLauro. And then the open seat, which was vacated by Elizabeth Esty, was won by Johanna Hayes, who is a former 2016 National Teacher of the Year. She's a teacher in Waterbury. She lives in Wolcott. She's very personable, very likable, but has no background in politics whatsoever. She was kind of handpicked by Senator Murphy to run. She won very handily, and now she will be heading to Washington as part of that new group of legislators from the Northeast. She's the first African-American woman to be elected to Congress in Connecticut, and she will be joining our delegation down there. So with that, I will turn it over to our federal folks to talk about the changes there.
Thank you, Gene. That was great. One quick question: how might the minimum wage legislation affect pharmacists? Is that going to hit us in some way?
Well, if the minimum wage passes to $15 an hour, the way that they've tried to do it in the past is a staggered format. So I think it's 10-10 now, and then would go up progressively over the next. I think they try to do it within a 3-year time frame. What that would do for pharmacists, especially retail pharmacists, is increase the costs in their stores. I mean, clearly pharmacists are salary-based, so they are not going to be as impacted as some of your hourly-based employees, but your pharmacy techs and your people running the registers and the other folks, it's going to raise your wage base across the board. I'm sure everybody's getting beyond $15 an hour, but when you raise the base of starting people from $15 an hour, the base goes up for everybody else.
Great, thank you. Okay, we're going to transition over now to Matt Magner, who is Director of State Government Affairs for the National Community Pharmacists Association, to talk a little bit about the state work going on nationally. Matt.
Oh, yes, thank you. Just make sure, can you hear me?
We can, thank you.
Perfect, great. So yeah, like Nathan said, I'm Matt Magner with CPA. So to give a brief overview of what we're seeing in the states nationwide, I'll first start with NCPA state priorities, and this is sort of, we listen to what's going on in the states, and so we build off our priorities off of that. And the first would be Medicaid reform, specifically reform in the Medicaid managed care program. There have been a few states that have looked into the PBMs who work with their Medicaid managed care program, and they've seen some things they don't like. Mainly, states are starting to realize the PBM spread and how much money PBMs are making off of the Medicaid program, and realizing that money's not going towards it's not going to the pharmacies or to patient care. It's staying with the middlemen, and they're doing some things about that. So in Ohio, they recently found $224 million annually remain with the PBM and in the form of the spread, and so they are looking into doing a pass-through model, pricing model, where the PBMs will get a flat fee, and there will be no more PBM spread. And what's great about there is the studies show that the state can implement that model while remaining cost neutral and putting more money into the pharmacy spend, so that pharmacies will see more appropriate reimbursements for their work. West Virginia did a complete carve out, so their pharmacy benefit is done through the fee-for-service program, so pharmacies know what they're going to be paid, and there's no discretion to the PBM. And West Virginia has saved a significant amount of money implementing that change. And then, so there are other states that are just starting to look into it, like Pennsylvania is looking into it. I know New Mexico is. And so that's something we're going to be following and helping along the way. And then not just the Medicaid managed care space, but also increasing the number of services that pharmacists can get reimbursed for. In the Medicaid sort of ties into the second priority, which is practice advancement and compensation for services. And so states are starting to look into greater prescriptive authority for pharmacists. A common drug is smoking cessation products. A lot of states are looking into that. One that's gotten a lot of press, within the past few years is naloxone. But there are other drugs too. There are certain contraceptives that states are looking at that would allow pharmacists to prescribe those drugs. And then the third priority is PBM regulation. This is something we've been working on for a while, and almost every state has some form of PBM regulation on the books. And so what we're trying to do is strengthen we advocated for MAC transparency when the maximum allowable cost lists were the main method of reimbursement. Now we're seeing a change where PBMs are starting to use what's called the generic effective rate. And so what we want to make sure that the PBM regulations cover that to make sure that they can't play any funny games with your reimbursements. And so that's something we've been working on. And also making sure that these laws are properly enforced. Even though the laws are on the books, a lot of states are saying there's no one to turn to, that the insurance commissioner is typically the enforcement authority over these laws, but sometimes the insurance commissioner is not enforcing them, a lot of times because the insurance commissioner has no idea what a PBM is or what they do or how to enforce these laws. But we're trying to educate them. We've been in contact with the National Association of Insurance Commissioners, and PBM regulation is something that they're just recently starting to talk about, which we're very excited about. And so those are sort of the priorities, what we think we'll be seeing. There's a couple other issues I want to discuss, and that's model legislation from national groups. So the National Conference of Insurance Legislators is currently developing a PBM Model Regulation Act. It would give insurance commissioners the authority to license and regulate PBMs. It would allow the commissioner to adopt rules addressing network adequacy, pharmacy audits, and reimbursement issues. It's currently being developed, and actually this week, INCOIL, as they're called, they will be meeting in Oklahoma City to hopefully adopt this model legislation. And CPA will be sending a couple of our folks there to advocate on, to make sure they push it through. So INCOIL, like I said, they're the insurance legislators. They work very closely with the National Association of Insurance Commissioners, so the executive side. And so this is a topic that they're both working on. And so like I said, this is an issue we hope that insurance commissioners will become more educated on. And then there's also the National Academy of State Health Policy that they've already developed and released a PBM transparency bill. It has the goal of improving the business practice and transparency of PBMs. I think the most exciting provision in it is it would require PBMs to act as fiduciaries of the health carrier that they serve. And so I think this would help with the transparency that folks, that states and plan sponsors have really been looking for. And so we are very excited about these groups because they are objective. In CPA, we have our own model legislation, and we think it's great. But when it comes from a national group that like INCOIL or the Academy of State Health Policy, we think it definitely gives us some more credibility, and so we'll be excited to go into the states with these bills, and we hope to see some great changes. And then the last issue I want to bring up is the Arkansas MAC transparency lawsuit. So Gene actually brought this up. Connecticut and 31 other states have joined an amicus brief supporting Arkansas's petition for review by the Supreme Court of the recent MAC transparency lawsuit. So Arkansas's MAC transparency law was challenged by PCMA, and the 8th Circuit decided that the MAC law was preempted by ERISA. So any ERISA programs could not be regulated by Arkansas's MAC laws, which that includes a lot of the health plans. So Arkansas has appealed that to the Supreme Court, and like I said, 32 states have joined an amicus brief supporting that petition for review. So hopefully the Supreme Court will take notice of how widespread this issue is, that states want to be able to regulate the insurance plans in their state and protect their patients. And so hopefully the Supreme Court will decide to review the case.
Matt, just before we move on, what do you see as the timeline around that MAC suit? Is it has not yet been taken up by the accepted by the court? Is that correct?
Correct. Honestly, I don't know. I would, I'm not sure, quite honestly. It would be within the next couple of weeks, I would assume that the Supreme Court would decide whether to take it up. And if they decide to take it up, I have no idea when they would when the hearings would occur.
Great. All right, we're going to move on now to Adam Harbison. Adam is the Chief Federal Lobbyist for NCPA. Go ahead, Adam.
Thanks, Nathan. Just want to make sure you can hear me before I get started.
Yep, can do.
Okay, perfect. Well, good morning, everybody. As I said, I'm one of NCPA's lobbyists here and just wanted to give you a rundown of the federal elections that just happened and what we expect when the new Congress convenes in January. So unlike your state elections in Connecticut, there really weren't any surprises. At the federal level, things kind of went as everyone expected. With Trump's low approval ratings, Democrats easily took the majority in the House of Representatives, and then due to some factors in the states that were up in the Senate, which mostly were sitting Democrat senators who represented Trump states, Republicans actually expanded their majority in the United States Senate. So in the Senate, the Republicans picked up 2 seats. Their majority, they will now have 53 Republican senators. Luckily for community pharmacy, a lot of the targeted senators that were up were some of our strongest pharmacy champions on the Democrat side of the aisle. So lucky for us, Joe Manchin from West Virginia, John Tester from Montana, Sherrod Brown from Ohio, all won and will be returning to the Senate this year. The other interesting thing for pharmacy in the Senate is that Chuck Grassley, who had been the Judiciary Chair from Iowa, will now be moving over to chair the Senate request from Medicare and a proposed drug pricing rule that the president put out. This is something that we've been working with the administration on over the past year, and that is to get some relief and reform from DIR fees. We've been meeting with countless agency officials and put forward a joint proposal with our partners at the National Association of Chain Drug Stores and the National Association of Specialty Pharmacies, which would eliminate retroactive DIR fees. Lucky that the administration decided to take up this proposal and formally propose it as a part of their drug pricing rule. So what we will be working on over the next couple of months is putting forward comments on the proposed rule. You can expect to see from NCPA a call to action for pharmacies to submit their own comments, and we'll have model comments for people to put forward. We'll also probably ask people to meet with their legislators to get the legislators to send letters to CMS and proposal. And it's something that we're really excited about because this would provide pharmacies with the relief that they need from DIR fees. And more importantly, it would save patients anywhere from $7 to $9 billion over 10 years is what Medicare has predicted in their own rule. And this would equate to about a $200 a year saving for seniors in their out-of-pocket drug costs. So you can expect to see more on that front from NCPA in the coming weeks. And with there, I'll stop and take any questions that y'all might have.
Adam, can you say a little bit about your grassroots endeavors on these issues and how we as and our constituency here as individual and independent pharmacists can engage?
Yep. We will be formally rolling that out over the coming weeks. Obviously, with the holiday, we probably won't do that until after the new year. The comment period doesn't close until January 25th. But you'll see a call to action from us, and these will be similar to things you've seen before, where we will give you a link to submit comments. We will have some model comments that you can add your own stories to, and I'll say our grassroots really has been really effective and what really drove the administration to make this change, because with our call to action we did earlier in the year, we actually had well over 1,000 individual pharmacists around the country submit comments on this proposal when it was part of the President's drug pricing blueprint to the administration. And it's something that Secretary Azar now in his talks about how much he heard from pharmacists on this issue, and that was why they needed to make sure that they proposed some relief to this. The other ask that we will have in this proposal is they kind of left it open-ended on when they would implement it. So our ask will be that they finalize this proposal as quickly as possible. And they said the earliest that they could do it was for 2020.
Great. One other thing, can you tell us about the dates for the fly-in and just a little bit about what happens there and on that day?
Yep. Our NCPA congressional fly-in will be April 10th and 11th here in Washington, D.C. And what the fly-in is we bring everyone together here in D.C., give you some education on what's going on in D.C., what the legislative priorities are, what's going on the regulatory front, and then give you some tips on what to do when meeting with your members of Congress, your senators, and their staff. And then we take everyone up to Capitol Hill over the 2 days to schedule meetings and go around and talk to your representatives and their staff about the issue, role you provide in treating your patients and serving your community, and how the members of Congress can be helpful in getting us the relief and authority that we need. And then we have a congressional reception as well, where many members of Congress stop by to meet people. So it's a great event, and really would love a strong delegation from Connecticut there to help us advance our agenda on Capitol Hill, especially in are in the majority in the House, and of course your delegation is 100% Democrat.
Jean, if you're still on the line, can you say a little bit about Pharmacy Day in Hartford?
Yes, I'm working with Nathan and Lisa on trying to come up with a date, probably in mid-March or so. But typically what we do in that is it's an evening reception where we encourage pharmacists to come up and meet with their legislators. It's usually very well attended. We have legislators, we try to focus on, we invite all the legislators obviously, but we try to focus on the members of the Public Health and Human Services and Appropriation Committees and also General Law, which is the Committee of Jurisdiction for Pharmacists. So it would be great to have a really good turnout of our member stores. We usually get a lot of the pharmacy students as well, but it's a good time of year to connect with your legislators. It will be particularly important since we have so many new legislators this year. So we'll get that date out to you as soon as it's finalized.
Excellent, thank you. It looks like we have a few minutes left. We could entertain a couple of questions. We haven't had any come in through email, but if you have a question out there, raise your raise your mute, as it were, and try not to talk over each other, and we can take a couple. Nope. All right, if not, we'll wrap things up. I want to thank you all for joining us today. As I said, this is the first in a series, and hopefully we'll continue to keep this conversation going. And